my name is Dr. Shahad Mohammed Abulanain, and welcome to the Health Talks. But before I tell you what this podcast is all about, let's take a step back into the beginning with the Health magazine. Let me tell you how it all started. In 1999, the Health magazine was launched with one clear purpose: to provide reliable, clear and accessible medical information to the public, something that was needed more than anything in our fast-changing world. This magazine has been a reliable source of health knowledge for over 2 decades, and today I'm very happy to share that we're extending this mission into a new medium, the Health Talks. This podcast is an extension of the same vision: to make health awareness more accessible, more engaging, and more interactive for everyone. We want to go beyond written pages and bring you conversations that actually matter. And behind this inspiring beginning of the Health magazine is a visionary leader whose commitment to healthcare, education, and community well-being made all of this possible. Dr. Thumbay Moideen is the founder-president of the Thumbay Group and the driving force behind the Health magazine. I'm very happy to welcome you today, Dr. Thumbay, and thank you very much for being here with me today. Dr. Thumbay, let's start with what was your vision for the Health magazine when starting it in 1999?
We started the Gulf Medical College in the year 1998, and part of the promotion, we were trying to advertise to get students, get good talent into the university. We were advertising and promoting. So somehow this idea came to me, we should have a magazine.
Right.
It wasn't really a magazine. Earlier it was called a health journal. So someone told us, it's a little confusing. Journal is very serious. It's very scientific. But here you are talking of reaching out to people and passing the message about health.
Right.
So we changed the name from journal to health magazine. So so we started in a very small, simple way with the simple agenda.
Right.
Yeah.
And what impact were you hoping that this magazine would leave on the community at that time?
Like I said, we were trying to reach out to people, create an awareness of our university, of health overall.
Right.
So initially it was a little confusing. I told you there was a confusion whether it's a health journal or magazine. But we were very clear, it is a commercial magazine.
Right.
Reaching out to the public for this, and I think it served the purpose. Yeah.
Definitely.
Yeah.
I mean, at that time, that wasn't very popular.
Yeah.
So to come up with this idea is definitely interesting.
True.
Because it helps people know more about their health and hear perspectives from experts.
Yeah, very true. But you have to also remember, anything you do, there is a cost.
Exactly.
So for example, when we built a medical school, there's a cost involved. So everyone is to ask, how will you make it sustainable? Same with the magazine. How will you make it sustainable? You can publish a magazine if someone is giving you a free grant. But imagine, we are a business house, So you have to make it sustainable. That means we have to make some revenue to pay the salaries and the costs. So we worked out a beautiful model. It worked for us.
Definitely. It's a great success now. So you've definitely established a very successful model, Dr. Thumbay. And what contributions has the Health magazine provided over those 2 decades? If you can reflect on it
The
with
main
us.
issue, like you said, was spreading awareness about health itself. So we have nice articles, and but overall, it also helped for me personally to promote the business what we are doing, like medical education, healthcare. We are into the whole range. We have clinics, we have pharmacies, we have laboratories, we have health clubs.
Exactly.
So it is indirectly promoting all our businesses. Yeah.
What was your proudest milestone with the Health magazine?
You mean the most memorable thing?
Yes.
No one will believe what I do. Every time I travel, I carry a few health magazines in my briefcase.
Wow.
Wherever I get a chance, I will put it on a table or in the airport, in the lounges, trying to promote myself shamelessly, So what happened once was, I was in Mecca, I went for Umrah. Those days I stayed in a hotel called Hilton.
Okay.
And then, as usual, I carried 2 magazines and put it on the table at the reception. My wife was saying, why are you doing all this? He said, no, promoting my business, I'm shameless. So I did that. What was the effect of that? When I came back, I got a call from the reception saying there's a Nigerian gentleman, he wants to meet you.
Wow.
Yeah, so I said, I don't meet parents and it's not my business, it's the admission office and the chancellor. So no, he's insisting he wants to meet you. He has some story to tell you. And then okay, so he came to me. You know what he told me, the story? He is from Nigeria, a very wealthy man, gone by private jet to Mecca.
Oh.
His daughter wanted to do medicine in UK. And being a conservative family, they were hesitating to send her to UK. So in the end, they didn't want to disappoint her and also. So they said, you come to Mecca with us, take a oath in Mecca that you will not deviate from a religion or a culture and things like that. So we took her to Mecca. And you know what happened? We stayed at the Hilton Hotel, we found your health magazine.
The amazing how the coincidence is.
And then he said, we made a call to Gulf Medical University and they said, there's one seat, if you come in 2 days time, you'll get the seat.
Wow.
So she came here, she was eligible and she got a seat and she graduated from here. He's a very wealthy man. So for me, it was the best thing could happen, my effort, everyone calls me shameless, it helped,
Definitely. I mean, Dr. Thumbay, you're proud of what you achieved, and
Exactly.
That's very important. It's important to always be proud of what you do and advocate for it. There is definitely no shame in that at all.
Yeah, true.
And you've achieved greatness, so
you.
You should always talk about it, and everyone should always talk about it.
I can narrate one more story if you want.
Definitely.
I was invited by the World Bank to speak in Washington about creating a private medical university and a hospital. Sustainable model. So I went there as usual. I spoke. Normally when I speak from my heart. People like what I am speaking. I make it interesting also. So after the talk, many people gathered around me asking for my visiting card, and I exhausted my visiting card. In the end, I had magazines in my book. I gave 1 or 2. After a few months, I got a call from someone and said, can you come and meet us in Atlantis Hotel in Dubai? So I said, who are you? He said, I am the Minister for Health from Ghana.
Okay.
And our president is here, he wants to meet you.
Oh, wow.
I said, okay. So when I went to him, I don't know them, totally new faces, So he said, you remember me, I was in Washington watching your talk and you gave me a health magazine and you put me on your mailing list. So every issue I get a copy. So I know you because of the health magazine.
That's amazing. Very, very interesting how everything unfolds in the end.
So the president then said, I want you to invite you to come to Ghana and set up a medical university.
Wow.
I said, if you support me, why not? We are looking at opportunity. We want to have a global presence.
Definitely.
So it was just before COVID. So they gave me a piece of land in a place called Accra in Ghana. We were unable to do it because of the COVID and things. And maybe in the future.
Definitely, that would be a great opportunity to expand on the same
thanks
vision.
to the health magazine, and thanks to my shameless attitude.
Now, Dr. Thumbay, how do you see the Health Talks podcast now building on that same vision of the health magazine?
True, like you said, this is the new trend with the advertising and promotion.
Right.
People watch podcasts, they like to watch podcasts, all the youngsters especially. So I'm sure this will help create awareness of the health also, same way helping our business also.
Exactly, definitely. It will help get bigger audience and to also spread health awareness to across different age groups.
True.
Definitely. Thank you very much, Dr. Thumbay. Now I would like to hear from your perspective. Of course, Dr. Thumbay, you've been invested in healthcare, well-being, education, and community engagement overall. What have you seen the biggest mistake people do when it comes to their health?
You're talking of personal or the
Yes.
healthcare?
Yes, personal. What mistake have people been doing that affected their
Everyone
health?
has to take care of your own health.
Right.
Yeah. So I have a small team of people
Hmm.
who are very close to me.
Right.
I insist, take care of your health. I push them to go to the dietitian, to the endocrinologist and see,
Right.
take care of your health. Because health is the most important. The day you lose your health, you can't do anything. Even if you have dreams and ambitions, if you don't have the health and the strength to do it, we cannot do it. So health is very, very important.
Exactly. That's a very interesting and important message as well.
Yeah.
To take care of your health and
Yeah.
to seek prevention before cure.
Very true. In fact, this year we introduced something called Thumbay Cares.
Wow. Okay.
I don't know if you're aware of it.
Tell us more about it, Dr. Thumbay.
See, we have about 4,000 people working in the group. So I said everyone should be healthy and conscious about his health. So we gave them free membership in our Body and Soul Health Club to take care of themselves.
Amazing.
So
as a medical student at Gulf Medical University, I had the same thing as well.
Yeah.
We had free access to Body and
this
Soul.
we are doing to all the team members.
It's amazing. Everyone who belongs to the Thumbay Group is definitely well taken care of.
Yeah.
Thank you, Dr. Thumbay. Now, what message would you give the public about how can Thumbay Healthcare help them achieve that goal of health awareness, prevention, and just taking care of their health overall? What can we do to help them?
About a Thumbay Healthcare, the first thing which comes to anyone's mind is this is part of a university.
Right.
It's an academic health. So when a doctor is treating a patient there, he is wearing two hats. He is a doctor and he is also a teacher.
Right.
So he is an academician. So that word trust is there. So anyone second opinion, you want reliable doctors, they come to Thumbay for that reason. In fact, we are taking care of lots of ruling family members because they trust us.
Right.
Only I remember when talking to them, I said, we come only because we trust you. We don't do anything unethical and things like that.
That's very true. I came into Gulf Medical University as a student because I had that same trust in your vision.
Thank you.
So I am an alumni of Gulf Medical University and also a doctor at Thumbay University Hospital.
Thank
so
you.
I can definitely say that we provide care with compassion, with love and commitment to teaching and continuing that cycle of healthcare professional, ethical healthcare professionals.
So you will be our ambassador in the future.
Definitely, Dr. Thumbay.
Thank you.
And now I want you to take me to the beginnings, to your childhood. Before you founded a university and a healthcare medicity, you were a child with dreams. What helped shape your early overlook about the world? And did you always envision yourself being a businessman in healthcare?
Frankly, no. My childhood is very interesting. I come from a very nice family, very successful family.
Right.
And we lived those days in a joint family. That means 3-4 generations living together, cousins and uncles.
Right.
So in my family, I had lots of role models. My grandfather was a role model, my uncle was a role model, my father was a role model. So they had many qualities which I said was fantastic. The best was they were very successful. 2, they were all family oriented people. Their life revolved around their work and their family. 3rd, they were very generous people. They were helping people and supporting the community. And lastly, they were also God-fearing and religious people. So I got these qualities when I grew up from them. But my personality was a little different from many people. I was a dreamer. I wanted to grow big, and people used to ask me, why do you think like that? We have enough and more.
Right.
If you come back to my country and see what we are doing, we are well to do, very wealthy people.
MashaAllah.
But I was still thinking, no, I have to do something big. So I did a lot of good things over my 40 years plus in business, I achieved a lot. But the story of the Gulf Medical College is a completely fluke one. I happened to come to the Gulf on a transit visa. I met a sheikh and he asked me a question, can you think of something, any business which can have multiple effects on our economy, Ajman? So I told the sheikh, build a medical school and a hospital. He said, what happens? I said, in the city I come from, in the neighborhood, there is one gentleman who's built a medical school and a hospital. The whole township has grown around it. It's become famous worldwide, internationally. So after a few days, I was in the business of timber and real estate. I was not in education. And I'm not an academician nor a healthcare professional.
Right.
I got a call from the Highness's office. Said, "Can you come and meet us?" I said, "Sure." So I went and I met His Highness, and he asked me about my background and all that. And in the end, he asked, "You spoke of some medical school and hospital." I said, "Sheikh, I just made a comment." I said, "It's good for your country. It will have multiple effects on your economy." He said, "You do it."
Wow. So from a simple discussion into
Exactly.
a great opportunity.
Exactly.
Wow.
But you should also realize I took up the challenge. It was not my field. So I bought professionals. I did a survey and I went back to him. So in the year 97, we decided we'll do it. 98, we launched it.
Wow.
It worked.
Within a year.
Within a year.
97 to 98.
Exactly.
That's amazing.
Yeah.
And Dr. Thumbay, do you remember the exact moment where you actually felt the power of education and that you wanted to contribute to that field? You said you've come from a different perspective, not related to healthcare, not related to education. Do you remember that exact moment where you were like, I want to invest in medical education?
I have come across that kind of situation many times in my life. As soon as I started the medical school, I realized this is one of the most noble professions what we are trying to introduce.
Right.
Being a doctor.
Exactly.
It's not easy. And it is very noble.
You're building a future.
A future. Yeah. No, noble. You can do engineering, you can be a commercial fellow, you can be a pilot, you can be a professional. But here you are saving lives and things like that. So many times I keep reminding, I've been quite principled in my way I conduct my business. At my level, definitely, I will not allow any kind of hanky-panky or unethical things. So, but one incident always reminds me of what I do. During my journey, I had many occasions where I struggled. It wasn't easy. Definitely. Imagine, we have hundreds doctors in the first hospital.
Right.
I have to pay salaries. It's new business in the country. So one time I went to His Highness, Sheikh Humaid bin Rashid Al Noaimi, the ruler of Ajman. So he likes me because I do good only and I'm a straightforward man. So he asked me, how are you, how's family, how's business? He knew everyone, our family members. He asked me, how's your business? I said, Sheikh, I'm struggling, Sheikh. It's not easy. So he told me something. I can never forget that in my life. He said, Moideen, I know you're a good man, you're a good Muslim, but do you realize what you're doing? I said, what, Sheikh? He said, you're doing education and healthcare. So as a Muslim, the best charity you can do in this world is giving shifa and giving knowledge.
Right.
Correct?
Yes, exactly.
So you're doing both. So he said, Allah will never let you down in this matter.
That's a very kind message.
Yeah.
Yes.
But it's a fact, it's the truth. Yeah.
Definitely. It's a very rewarding investment at the end
so
of the
I
day.
feel these things make us keep going,
Right.
Yeah.
And Dr. Thumbay, you've said that it was a challenge for you in the beginning. What actually gave you that courage to take up that challenge and I'll do it?
Like I said, from my young age, I was dreaming of creating big things. I wanted to make a mark before I go. So in a way, I was also a crisis manager in my family. So when there were issues, there were personal issues, and I was always there to sort it out.
Right.
So these qualities in me help me to overcome all the challenges.
It's good
Yeah.
to be ambitious and a
Yeah,
dreamer.
I was
and-
always ambitious.
And that is what you are, Dr.
Yeah,
Thumbay.
thank you, thank you.
You've launched a Gulf Medical University.
Yeah.
It was Gulf Medical College at that
In
time.
the, in the beginning. Yeah.
Within 1 year. Do you remember the earliest challenge you faced when you're trying to establish such an institution?
Frankly, you know, we were trendsetters. There was
Right.
no medical university in the entire Middle East. Government had, but not private.
Not private, exactly.
So everything was a challenge. Everything. For example, when they were setting up the anatomy lab, they said we need cadavers, dead
Cadavers.
bodies. So can you imagine?
Yeah.
So
How
we
will you
tried to
get
scout
it?
first
Yeah.
dead bodies throughout the world. Ultimately, we found a supplier from Germany. He supplied 6 cadavers. He came here. The police seized it. He said, how can you bring dead bodies to our country? It's an Islamic country.
Right.
Imagine 20, 30 years ago.
Right.
So I had to go back to the Diwan and ask them for help, and so it's for academic purpose. So small things, but so many challenges, you know.
Right.
Yeah.
Because it's a new experience at that time.
It's new to the country itself.
That's very
Yeah.
inspiring,
Yeah,
Dr.
true.
Thumbay. Now, how did the UAE environment and leadership help you thrive? You didn't just build a medical college for MBBS, you built a whole medicity of
Yeah,
different
yeah.
specialties,
Yeah.
healthcare facilities, hospitals, pharmacy.
Mhm.
How did you thrive in the UAE? You've received many
Yes,
support.
UAE is a
yeah.
beautiful country. The leadership is very wise, you know.
Exactly.
So it's not unlike other countries. When we are doing something good, they encourage us. But I just want to remind you, Gulf Medical University is not a small university now. We have 8 colleges, and we are in the process of building 15 colleges in the next 3 years.
Wow.
Different subjects, different interesting things which have never been tried in the country. Like we are launching the veterinary college.
Yes, that's a
So,
very proud achievement.
Exactly. It's a whole, you know, for that we have to build the whole range. You have to build clinics, you have to build hospitals, you have to have a farm, you have to build a laboratory. And we have some nice tie-ups internationally, Royal College of Veterinary in UK, and things like that.
When I was a student myself, I would always wonder because I had friends who were interested in veterinary medicine in school.
Yeah.
So I would be like, what would they do with their life if they want to study veterinary medicine? Or when will veterinary medicine come in a private university accessible for everyone?
Yeah.
I never imagined that it would come from my own alma mater,
Yeah.
but it made it even more proud
Thank
a
you.
moment for
Thank
me.
you. So many interesting things happening, you know.
Exactly.
We're coming into alternative medicine like Ayurveda, homeopathic, Chinese medicine. We're thinking of ultimately having integrated medicine. The
That's
plan is
amazing.
next 3 years, yeah.
And also psychiatry care.
We are going to call it the mental health college.
Amazing.
I told you 15 colleges is going to happen in the next 3 years, yeah.
That's
Inshallah,
very,
yeah.
very exciting, and
Thank you.
I'm looking forward to all of it, Dr.
Thank you.
Thumbay.
We want you to be part of it. You know.
Bless you. Thank you,
Yeah.
Dr. Thumbay. If you'd look over your whole life so
Yeah.
far, would you change anything, or if you would relive it all again, was there something that you would change or do differently?
I don't think anything can change, you know.
Yeah, alhamdulillah.
In
everything-
fact, my journey has been very unique, you know. It's
Exactly.
not that I copied someone. Or
Right.
I just followed my dreams and I chased my dreams.
Yes.
Yeah.
That's the reward of perseverance.
Mm.
You've chased your dream till
Yeah.
the end, and it turned out
Mm.
into a rewarding outcome.
Yeah,
Amazing, Dr. Thumbay.
thank you.
Now, if you would reflect on medical education,
Yeah.
so in how it was early on and now, what would you envision for Gulf Medical University in the next 10, 20 years? Where do you see Gulf Medical University in 2 decades maybe?
You know, recently I had an official from the government visiting me,
Right.
and he was talking to me. He was impressed with what he saw. He hadn't seen it before. And he said, you know, I realized something. I'm a government official, but you are private. But I have to appreciate, you know, what you're doing. I feel you are the #1 medical university in the Gulf.
Wow.
He was admitting. So the dream is to be the best in the Gulf or maybe leading in the world, and we are working very hard for that. As administrators, as management, our focus is on two things. One is to maintain quality. So we're trying to get all kinds of accreditation, all kinds of membership to maintain the standard. And number two, being progressive. We have to keep growing. I believe it's like cycling. The day you don't pedal, you lose balance.
Right, definitely.
Yeah.
So the importance is to keep going with the same force, with the same effort.
Yeah.
Definitely, Dr. Thumbay. And since you're an educator and you invest so much in medical education, what do you see is the most important quality doctors should have beyond medical knowledge itself?
Like I said earlier, medical education or being a doctor is a very noble profession.
Right.
So being ethical is very important, and also being updated with knowledge. Now AI is coming to, it's a big force now. People have to be aware how do you utilize AI in your everyday life or in your profession.
Right. To implement technology in an ethical way.
In ethic, it's very important.
That's very true. And what promise should every doctor make, or every GMU medical student or a student in general make to themselves and to the future? What should they always be committed to? What message would you always want your
as a
alumni
profession, they have to be clean and straightforward. And
Definitely.
At the end of the day, they are going to represent us, they're ambassadors.
Right.
Seriously, whenever I go around, we produce almost 60% of the health professions of UAE.
Wow.
I don't know if you're not aware of that. Yeah.
No, I'm hearing
I'm
it for
talking
the
of
first
every
time.
subject, medical, dental and all that. We are almost 60%. So wherever I go, I feel there's someone who's a ex-GMU.
Right.
Like recently I went to the Ministry of Health to sign an agreement. There is this situation here where the government wanted us to support them with the healthcare. So when I was signing, there was a gentleman helping me. I asked him, what's your name? He said, doctor something. Sir, you don't know me, I am your student.
Wow. That's a very rewarding moment.
Rewarding. Everywhere. You go to Ras Al Khaimah, you go to Abu Dhabi, we see our alumni working and successful.
Dr. Thumbay, you're leading in healthcare and you're leading in education, mashallah. And we've recently heard of your initiatives in research. Can you tell us more about that?
Every leading university in the world has got research as its main component. So there is an element of research in most of the top universities like Harvard, Johns Hopkins, Cleveland. So in this part of the world, it's not very common. So we introduced research. We want to make it a research-based university. So we have a research grant of 3 million we distribute every year for the last 2 years.
Very
This is the third year. And we have partnered leading universities like Harvard and MBRMU and Khalifa and all the top universities, and doing research in various subjects. So we have an ambitious plan. We are going to put up a research building called Thumbay International Research Center. So in the next few years, it will develop into a huge department.
That's a very futuristic vision, Dr. Thumbay.
That will help the university to have also in the ranking. We are a specialized university, so it helps based on our research and activities. I want to add before I conclude this interview, the dream is not to have only a medical university and hospital in this. I want to have a global presence.
Right.
So we have tie-ups for like we call it twinning in the layman's language, but it's called the Thumbay International Pathway Program, where students come here for 3 years and go to different countries for 3 years.
That's a very unique pathway.
It's a unique
to Gulf Medical University.
True.
Actually.
So we have tie-ups with almost 8 universities around the world, with Poland, Italy, Egypt, many countries, Malaysia, Ghana, Ethiopia, so many of the countries. So with this, what happens is we have a presence in all these countries. So in the end, if someone analyzes the whole thing, we could become the biggest network of medical centers in the world.
Right.
Because we could have about 1,000 student intake per year in the next 2-3 years when we are well established.
And you're helping spread that same message, same quality of
Yeah,
education
same quality. So
to many students around the world. So
Yeah,
everyone
very
can
true.
get that GMU experience
Correct.
wherever they are.
Correct, exactly.
Lastly, Dr. Thumbay, if you'd have one wish for the next generation of doctors from Gulf Medical University, what would you wish them? What message would you give them?
Seriously, I pray from the bottom of my heart for the success of our doctors. You know, they are like my children.
Right.
And for my family, what I feel is this legacy has to continue. You know, it's easy to sell off this business and make billions, but this what we are doing activities, it has to continue.
Right.
So I'm hoping and praying my children will continue this legacy, or my grandchildren will continue the legacy and not sell it off. You know.
Right.
Yeah.
You want everyone who's belonging to Thumbay Group or Gulf Medical University to
Yeah.
carry that message
Carry-
forward
yeah, correct.
and continue the same vision.
Yeah, true.
Definitely. Thank you very
Welcome,
much, Dr.
welcome.
Thumbay, for joining us today
Welcome.
and for helping us inaugurate this amazing
Welcome.
podcast.
We wish you all the best. No, you should be a huge success.
Thank
Any
you.
support from my side, we are always there to support.
Thank you, Dr.
Okay.
Thumbay. You're providing support to everyone
Oh,
at
thank
Thumbay
you.
Group. And thank you very much to our listeners. Stay tuned for very exciting episodes coming next.